welcome to Ask the Expert here on Hello Doctor PH. My name is Kai Magsanok and I'm the Editor-in-Chief of Hello Doctor here in the Philippines. With us today is someone who's going to talk to us about the relationship between diabetes and cardiovascular disorders. So, I know for certain that diabetes is one of the top searches on Hello Doctor Philippines. So, Doctora, I'm pretty sure we have quite a number of audience watching our interview today. So, to introduce our guest, we have someone who is the chief of the World City Medical Center section for endocrinology. She's a member of the Core Trainers Group. She is the treasurer of the Osteoporosis Society of the Philippines Foundation Incorporated. She is a diplomat and fellow of the Philippine College of Physicians. She is a diplomat and fellow of the Philippine Society of Endocrinology, Diabetes and Metabolism. She is a fellow of the American College of Endocrinology, and she is the president of the Alliance of Clinical Endocrinologists, Philippines. Welcome, Dr. Teresa Marie Valdez Fallier, also known as Doc IE Fallier. Hi, Doc IE.
Hi, and good afternoon. Hello, Kai. Thank you for inviting me to talk today.
Of course, yes. Thank you for being our first ever guest in our Ask the Expert video series. Our goal really in Hello Health, in Hello Doctor, is to democratize healthcare information to everyone. So I'm sure we're coming together because a lot of people, I don't know the data on diabetes. We'll get to that pretty quickly. Pero Doctora, my first question, why do you think it's important for us to have this conversation? Why do we need to talk about the relationship of diabetes and our cardiovascular health?
Well, first and foremost, diabetes is a fast-rising public health problem, not only in the Philippines but worldwide. And it's brought about usually by being sedentary and obese, which is what we're having nowadays. Like during this COVID pandemic, a lot of us are just staying at home and not doing much, not having any physical exercise and all of that. So diabetes has been on the rise lately. And in my private practice, actually, I've seen a lot of newly diagnosed diabetics who a year ago or 2 years ago have not been diabetic, yet right now they are. And the thing about it is because diabetes leads to a lot of complications, primarily one of which and is most important is really the cardiovascular diseases. Mm-hmm. So I think it's really very important that we should be talking about diabetes and its complications nowadays.
I completely agree with you, Doctor. My father passed away to complications brought about by diabetes.
So I'm sorry to hear that.
It's okay, but he left us a very good lesson to really take care of our health and be mindful because it runs in the family, sa mga magsano. So that's an opportunity for us to be more mindful of our diet and our lifestyle. Okay, so Doctora, tingnan natin yung lay of the land, the state of diabetes in the Philippines. How many Filipinos are currently suffering from diabetes?
Well, as of the year 2019, there were about 4.9 million diagnosed diabetics in the Philippines. Our prevalence rate is about 6.1%. So I guess that almost 5 million has exponentially increased during this COVID times. But of course, we want to do our best to prevent those numbers from rising.
Yes, that's why we're having this conversation. Doctora, what kind of diabetes is the most prevalent? So let's go to the parang yung basics. Diabetes for dummies muna tayo. Ulit na information na pwede nilang kunin kay Dr. Google, dito na lang nila kay Doc IE tanungin.
Okay. So first, let me talk about the different types of diabetes. So we actually have 4 different types of diabetes. The first one is type 1 diabetes, or what we used to know as insulin-dependent diabetes mellitus, or your juvenile onset diabetes. It's brought about by the patient's pancreas not being able to produce insulin. So for these patients, the onset of diabetes is during the younger days, though we still see this type 1 diabetes in the adults. But their main problem, since they don't have any insulin, is they have to inject insulin for them to be able to control their sugar. This type 1 diabetes accounts for less than 10% of diabetics worldwide. Now, the most prevalent type of diabetes is the one that we know, the type 2 diabetes. It used to be known as non-insulin dependent diabetes mellitus. So, from its name, it does not really need insulin for it to be controlled. The main problem with it is that the pancreas, or the body's factory for insulin, is not able to produce enough to supply the demand of the body. So the sugar levels just keep on rising. Now, the second problem in type 2 diabetics is insulin resistance. It's when the body is not sensitive to the effect of insulin. So insulin is very important because it's the one that brings the sugar levels inside of our liver, muscles, and fatty tissues. So if these tissues do not respond to the insulin, the sugar gets left out and they're just in your blood. So that's the reason why when you check your sugar, it's your blood, the sugar levels are really very high. So that's the most prevalent type of diabetes, the one type 2. Now, the other two types of diabetes would be the diabetes ng buntis, or your gestational diabetes. It's secondary to the pregnancy hormones. No? Usually, this gestational diabetics, they become type 2 diabetics in later life. And then the fourth type of diabetes is diabetes secondary to other illnesses. Like, for example, there are some patients who have an excess of growth hormones, so they can develop diabetes, or those who have an excess of steroids in their body. Either their body produces too much steroids, or they're taking steroids for other causes. So because of this, their sugar levels go up, and sometimes they are having diabetes already. So these are the types that are reversible diabetes, but the others, we have to live with it.
Oh no. Yeah. Oh gosh, the human body is so complicated. So, you already explained the causes, no, doktora? Pero, magpakaano tayo, yung usual na naririnig natin, di ba? Habang lumalaki. Huwag ka kakain ng matamis, magkaka-diabetes ka. Matamis, yan ay diabetes, ganyan. So, is that really it? Ito ba ang puno? Sweet food?
Well, yes. The diet actually has a lot to do with your sugar levels going up, because some of the patients or some of the people really just get to eat a lot and not exercise. And then especially when you get to eat those sugary foods that really don't give you any healthy calories, these are the ones that will really make you unhealthy and sick. So if regarding the one that you're saying earlier na huwag kang kain ng mga matatamis, well, in a way, it really does make your sugar levels go up if you're not exercising, you're not taking enough water, and if you have a predisposition to diabetes, then it's really good for you not to be eating too much sweets. So, but you have to remember that it's not like, if you're diabetic, you cannot eat anymore any of the sweet foods. You can still eat as long as it's in moderation. So moderation is the key. Yes.
Moderation, balance, and exercise. Not really exercise. Okay. So let's deep dive into the causes. Among all the causes of diabetes, which is the most prevalent, and why do you think this is so?
So, as I've said, the most prevalent type of diabetes is the type 2 diabetes. No? So, it's found in about 70 to 80% amongst the diabetics worldwide. And probably it's because of the rapid urbanization of our life. No? So, when everything is westernized, everything is automatic, it's not like before in the good old days when people really get to walk around and do things for themselves. Unlike now, it's the machines that do everything for us. So I think it's because of the sedentary lifestyle and the access to too much food. No? So it brings about obesity. And obesity is one of those prime factors that brings about insulin resistance and later on diabetes mellitus type 2.
Gosh, so Actually, we're having this conversation, I think, for a lot of people, even for diabetics. So, Doctora, it's not too late. Diet and lifestyle. Diet, and of course, the guidance of your doctor, your physician, and then your lifestyle. I have, I do have friends who, after getting diagnosed with diabetes, that's when they embrace the healthier lifestyle. They look better, they look younger, they're even fitter. So it's not necessarily a death sentence, quote unquote.
Correct.
Correct.
Yes, Kai, I would always tell that to my patients because
Mm.
sometimes they just discover that they're diabetics based on the annual exam. And then so they get so sad whenever I tell them that you really are diabetic already. And some even cry, But I tell them it's not like cancer that you just have several days or years to live, no? It's really easy to live with diabetes. The first step is to accept it. Because you see, there are a lot of people nowadays who you don't know are diabetic because they're very active, they can do whatever they like. So it all boils down to acceptance and being disciplined because it's not really difficult to live with diabetes. You just have to live in moderation.
Mm-hmm. Yeah.
Yes.
Consistent with your healthy habits. No, Doctor?
Correct. Yes, yes. That's true.
So, Doktora, meron akong mga naririnig din. Diabetes runs in my family. No? So, tanggapin ko na lang. Or can I say, like me, kami sa mga magsanok, it runs in the family. Do I have a chance to make it stop with me? Because I have a son. And sometimes when my kid eats a lot of rice, it really affects me. But, he's 19. But
Yeah.
should I
Growing.
or do I encourage him not to exercise? No. Anyway, the generational curse, of diabetes, can it be stopped? Can a generation stop it?
Well, Kai, I have some patients who tell me that actually their grandparents are diabetic, but their parents are not, and now they are diabetic. So they say, Doctora, is it true that it skips a generation? Well, I think the reason behind that is because the children of the diabetics already saw how their parents are suffering. So that's why they took it upon themselves to discipline themselves, have a good diet and exercise and all of those lifestyle goody things so they don't become diabetic. But now the children of those people, okay, didn't see the hardships or sufferings of a diabetic person. So now they don't know about it. So they're the ones now who get to lead like an abusive lifestyle. So they are the ones who develop diabetes. So the long and short of it, Kai, is that if you know that diabetes runs in your family, you can always just be careful, live in moderation, practice a good lifestyle. It's like when diabetes runs in your family, it's like you're a loaded gun. But the trigger has to be clicked for the gun to fire off. So it's the same with you people who has diabetes in their genes. There should be something that would click the diabetes to go into existence. And it's up to you on what you should do to not let it happen. No? So with regards to your question, can it just simply stop with you? Yes, if you're going to teach the future generation to take care of themselves.
Oh my
Then
God.
diabetes will stop in the family.
Yeah, so there is hope. There is hope for families. Yeah, who have diabetes that runs in their family. We have the power, our generation, we have the power to teach the next generations how to stop it so that hindi maklik yung trigger, no? And we start new generations of healthy members of the family. Okay, so let's go into diet, Doctora. Let's go into more practical ways, no, that we can apply what you've been teaching us since the start of this conversation. So, when we go to the gym, no, any fitness person we meet, they say that more than 70% is actually what you eat. It's not what you do, right? It's what you eat. It's what you're doing, what you're eating when you're not in the gym. So, Doctora, a concrete example of a daily diet for someone who is trying to avoid diabetes. Can you give us an example of how the daily diet looks like?
Well, in the Philippines, we have what you call the pinggang Pinoy. The pinggang Pinoy is the ideal or healthy plate for every Filipino. It consists of like half of the plate would comprise of your vegetables and all the fiber and a little of the fruits, and then half of that would be your proteins, which would be your fish and meat, kumbaga your ulam, and then the other half of that would be your carbs. So it's like 1/4 of your plate would be your carbs, 1/4 will be your proteins and fats, and the rest would be your fiber. Okay, and then outside of your plate there will be a glass of water. So that's how the pinggang Pinoy looks like. But if you want to have a more detailed way of how to go about it, we have the Mediterranean diet, which is actually the diet that is recommended by the American Diabetes Association for the people with diabetes. No, so it's really a healthy type of diet wherein there will be more fiber, that would be fruits and vegetables and proteins, and the good oil, which is olive oil, no, and a little of the carbs. So remember, there's still carbs in every good diet. You cannot take out the carbs because the carbs will still be the primary source of your sugar. And sugar, remember, is like your gasolina. It's the energy provider for your body. So you still need a little of the carbs, but not too much. Okay. So that's the Mediterranean diet. It's one of those diets that we advocate for also.
Great. Yeah. I think we have a story on the Mediterranean diet kasi nga diabetes is really a top search here in the Philippines.
Yeah.
So, Laura, how about a daily diet that will help one who is already managing diabetes? Is it the same?
This is the one that I always advise my patients because they're always saying, Doctora, what is bawal ba? What should I not eat? What should I just be eating? No? So in the Filipino household, or especially in the Filipino patients with diabetes, I find it funny that whenever I say, wala pong bawal sa inyo, you just have to eat everything in moderation. They always say, what? Walang bawal? Para bang kailangan may bawal when you're diabetic. So the good news, people with diabetes, is actually there really is no bawal as long as you're going to eat everything in moderation. So I don't like patients with diabetes who are sad because they will say, Doctora, I really want to eat leche flan, but can I not even have 2 tablespoons of it? Of course you can, no? But you cannot have the whole lanera. You can I eat halo-halo? Of course you can, but you cannot have the whole halo-halo. Can I eat ice cream? Yes, you can. You can have half a cup. But the thing is, you have to eat all of these sweet foods in moderation, at the right time, in the right amount. No? So Kai, if you're asking me, can you give me an example of what are the things that I should be eating on an everyday basis? You eat all the food groups, carbs, proteins and fats, and then your fiber. No? So what is there in your table right now does not have to be specially made for a diabetic. You can eat whatever the rest of your family is eating, but you have to be mindful of how much you are eating. No? So sometimes it boils down to the quantity. For example, just a solid example, people always ask me, which is better to eat? Is it the white rice or the red rice, the black rice, and whatever color of rice there is available? And then they say, because Doctora, they said the red rice has more fiber, so it has lesser sugar content, which is true. However, the difference between the white rice and the red rice is not that much. So that means if you'll have 1 cup of white rice, now that is equivalent to 2 cups of red rice. So you get it, Kai? So it's like magre-red rice ka nga, but you're eating too much red rice. So the suma total is the same. The rise in blood sugar is still very high. So that just goes to show that when you're eating, even if it's the right food, you still have to be eating it in moderation.
Okay. The right amount.
Yes, the right amount.
Pero Doctor, you mentioned you have to eat it at the right time. Okay?
Okay. Yes.
Is there a particular, kasi when I was when I was a lifestyle journalist, no, a lifestyle editor, I would attend, events sa mga, alam mo yung mga slimming clinics, no, doktora. Tapos, syempre, ililibre ka ng consultation, tapos sasabihin sa akin, sige, I remember this, sinabihan ako, pwede ka mag-rise hanggang 2 p.m. lang. Yung mga ganun. Pero I'm asking this, doktora, my question is basically, meron bang time of the day where our body also kind of slows down, alam mo yun, in breaking down?
Yes.
So is there a certain cutoff? No, is there a certain cutoff? Sige, I'm gonna have rice for dinner, but at what time should I have eaten my dinner, for example?
Oh yes. Actually, have you heard about the saying that the breakfast should be eaten like you're a king because it's the largest meal of the day, and then the lunch should be like 2/3 to 1/2 of your breakfast, and then your dinner should be like just a third or 1/4 of your breakfast. No, so the reason for this is because when you eat breakfast, you're going to have a lot of activities for the rest of the day. So you should pack in energies. But if you expect that you're not be moving around for the rest of the day, so you don't eat a lot. So it works like that. Now, during dinner time, we tell the patients don't eat a lot of carbs anymore because you'll be sleeping in a while, and then you won't be using up all of these carbs that are turned into sugar and are supposed to be used up. So they will just be stored. No, so these are the ones that will now be stored as fat. So that's the reason why you don't want patients to be eating a lot of rice or carbs during the night. No, with regards to what should be the appropriate stop time that you should be not eating anymore any of this rice. Actually, it will depend on your activity level. If you have activities until the middle of the night, then you can have it as late as about 9 or 10. But the thing is, what we really notice about diabetics is that when they eat past 9 or 10 p.m., that's the time that their sugar levels in the morning are really quite high. And these are the people who really pack up a lot of bilbil or subcutaneous fat. No? So parang they're the ones who really get to be obese or overweight later on. It's because they have this extra eating a lot at bedtime. No? So no more carbs after 8 p.m.
That's
It's like, Kai, you've heard of the intermittent fasting, right?
Yeah.
No? So parang it's like a nicer version of your after 6 diet, wherein after 6 p.m., di ba, before na uso yan you don't get to eat anything anymore. So parang the intermittent fasting is like that. There's this time period where you don't eat, and then there's this 8-hour window period wherein you're going to eat. No? So parang ganun din yung yung principle doon. No? So during the night, you don't get to eat much. You don't get to eat anymore because you won't have any activity. You're just going to be sleeping. If you're just like the ordinary person, but there are a lot of people nowadays who are awake during the night, diba? Especially the people from the BPO community.
Right.
They're the ones who are awake during the night. So wala silang choice to, kumbaga, they just get to eat a lot to keep awake and all of that. And this really makes them unhealthy.
Yeah. It's a challenge, no, Doktora? Lalo na ngayon, the gig economy, no? Because of the uncertainty, a lot of Filipinos are working more than 1 or 2 jobs at the same time. No? So,
correct. Yeah.
Yeah. So, let's talk about activities, Doktora, and exercise, no? In relation to diabetes. Meron bang ideal exercise that we should be doing that will help us, break down the insulin? Is it the aerobic exercise?
The sugar. Break down the sugar.
Sorry. Is it the aerobic exercise, or gayahin ba namin ng workout ni Hidilyn Diaz, for example? Hidilyn literally lifts and squats. That's part of her, alam mo yun, daily fitness routine. Pero tayo mga, okay, kailangan kong, so ayokong magka-diabetes sa generation ko, na gusto kong maging healthy. para hindi ako magka-problem din sa heart. Ano ang exercises na dapat na ginagawa ko araw-araw, doktora?
Well, usually we ask the patient what exercise can you do. Something that you can be doing every day, at least 30 minutes every day, or 2.5 hours a week in separate days. No, so that's the time requirement for you to be exercising. So what kind of exercise? Well, preferably the cardiovascular exercises that we say, like walking. Walking is one of those most important and one of the best exercises that you can do. So especially during this COVID season, all of the patients are saying, I was not able to exercise because I can't go to the gym. Kasi diba it's ECQ, the gyms are closed and all that. And then when it's rainy season, they're saying, I cannot go out because it's raining and all of that. So, but walking is something that you can do in the confines of your house or in your room or even in a very small space. You can still be walking. So I keep on telling the patient, do an exercise that will let you move all parts of your body. One that you love, like dancing, like either Zumba or aerobics. No, so do something that you think you will be able to sustain. So something that you enjoy, because that's the most important thing, that you enjoy doing that. So you get to be doing that every day. That's important. So if it's walking, they enjoy walking, so go about that every day. You go 30 minutes every day. And then if they say na, Doctora, I'm so busy to spend 30 minutes of walking every day. Is there anything else that I can do? So I tell the patient, well, after each meal, you can do like a 10-minute walk around your table or inside your office. And so if you do like 3 10-minute walks after each meal, you're now having 30 minutes of walking every day. Or if they say, I'm really so busy, I still cannot spare those 10 minutes, those 10 minutes 3 times a day. So I tell them, then you have to incorporate it into your daily life. For example, they always drive a car. So they park at the farthest point in the parking space before they get into the office, they go around the building first. Or instead of taking the left or the elevator, then they just take the stairs. And then they tell me, Doc, my office is in the ground floor. Okay, so, well, you can still walk around the building, or you can take the stairs, take 2 flights of stairs twice a day before you go into your office. So we just have to be like more creative about it, no? So let's try to look for a way to exercise, because I always tell them, your health comes first. Yeah. Hindi po pwede na work ka ng work and then napapabayaan mo yung health mo. So exercise is one of those very important things. It's a pillar in the management of diabetes. So there, yes.
It's priority alongside your work, if not higher, no, Doktora?
Correct.
So,
yes.
You can jog in place, di ba, Doktora? Or pretend, skip rope. Yung mga ganon. So many things.
Okay. So just a word of caution for that. No, we actually do not recommend jumping or even jogging, because this may like injure your knees later on. So if ever,
maybe that
brisk walking is really gonna be the best if you would like to do some jogging. Yes.
Okay. So walking or brisk walking.
Okay. Yes.
Sige, thank you po. Noted po yan. I-highlight natin yan dito sa ating video. So, so how bad is the diabetes situation now with COVID? And then we're going back to another lockdown.
Yeah. So it's quite sad, because what we realized during the first COVID surge was that that people with diabetes were like left out, no? So they're the ones who are regulars in the clinic. So like, again, in my practice, I tell my patients, you have to see me regularly every 3 to 4 months, like that. And if the sugar levels are really uncontrolled, I have to see them more often. So when the COVID pandemic occurred, so these are the people who were not able to really see their healthcare providers. And so a lot of the diabetes control went haywire. Okay. But we have to remember that people with diabetes are the ones at high risk for severe complications of COVID if they get infected. So it's really a very bad time for the people with diabetes and their healthcare providers during this COVID pandemic. We're really very affected by it.
And diabetes is a comorbidity, correct?
Yes. It's a comorbidity just like hypertension and cardiovascular disease that if they are present in a patient, the chance or the risk for a serious complication is there. No?
Okay.
So I always tell my patients with diabetes, you really still have to take care of yourselves even if you're just staying at home and working from home. Yes.
And even if you're vaccinated, follow the protocol still. No, Doctora?
Correct.
Mask.
Yes, that's very important.
I don't even mind the face mask, to be honest. I mean the face shield. No?
Yeah.
Parang
well, actually, the face shield kasi, the face shield is for you not to keep on touching your mask. Yeah. Kaya ka pinag-face shield. Kasi di ba, a lot of people, hindi kasi talaga sanay na naka-face mask. So, ang nangyayari, hawak ng hawak sa mask and all of that. So, I think the face shield is there to protect us from keep on touching your face. So, you don't get infected.
Yeah. Doctora. Okay. So, Doctora, when one is found to be, let's go to diabetes management. What should one do when he or she is found to be borderline? Dumata tayo sa borderline diabetic, di ba? Pag ganyan ba, ginagamot na, Doktora? Tapos di ba may mga matigas ang ulo na, di ba may gamot naman eh. Di ba?
Yes.
Sige, Doktora.
Actually, Kai, that's a very Filipino remark. I'll eat all of these matamis kasi I have gamot naman given by Dr. Fallier. So, it's really funny that way. But with regards to your question, what happens if a patient is diagnosed to be pre-diabetic? Well, first and foremost, we have to assess, is this patient really at high risk to become diabetic later on? Okay, there are some studies that show that it's just a play of numbers, kumbaga. So, a lot of research has gone into pre-diabetics developing macrovascular or big vessel disease, the same as that of a diabetic. No? So, kapag ang pasyente, if a patient is at high risk, really, meaning the patient is also hypertensive, has high cholesterol levels, and they're found to be borderline diabetics, then it's a must. They should be treated already. Because it's passé anymore when the doctor says, ay, nako, you're just pre-diabetic, borderline pa lang yan, mag-diet, exercise ka lang, and then it will go away. Pero the thing is, it really does not go away. The diet and exercise, unless the patient's really motivated, the numbers don't go down. The sugar levels just pile up. And before you know it, the patient has crossed the border and is now a full-blown diabetic. So nowadays, what we want to do is give already, aside from the lifestyle intervention, we already give a medication. Some patients would say, Doc, I'm just pre-diabetic. Why do I have to take medications already? So it's just a simple matter of explaining to them that because the longer time that you stay pre-diabetic, you're still going to be developing the complications of diabetes for big vessels, as I have said earlier. So if you explain it to them that way, then they would understand and then they will follow you.
Yeah, they will take it more seriously. No, Doctor?
Yes, correct. So with regards to I have gamot naman or I have this medicine, especially those patients who are already on insulin, no, they will say, I'm on insulin, so that means I can eat anything already because I can just simply adjust my insulin doses. Every time I'm going to eat more, I'm going to add more like that. But that's just not the way it should be. We should still be disciplined. Sometimes a patient who's type 2 diabetic is placed on insulin for a faster control of their glucose levels. So if these patients are still undisciplined, then it's all for naught, no? So sayang yung panahon, sayang yung pera pambili ng insulin and all of that. And furthermore, the longer time that they are uncontrolled, the greater is the risk that they're going to develop all of the complications. And it's the complications that we're really scared of, because once the complications are there, they cannot be reversed. And that's what I keep on telling the patients. You cannot cry anymore when the complications are there, because I cannot help you. So the thing is, let us prevent these complications from coming in. So now that I can still help you, we don't have complications, so help yourself also.
Okay.
Be more controlled. Yeah.
Pero doktora, sige, let's inject some fear factor, no? Kasi may mga taong kailangan yun eh, no? Let's talk about the complications. And again, going back to the cardiovascular, for example, no? So,
yes.
What are the complications that may arise from diabetes?
Well, first and foremost, the most important thing that this one, it's actually not the fear factor thing. I tell the patients, kinikwento ko po ito sa inyo kasi ito po yung mga facts. Okay? So, fact number one, it's like 80 to 90% of diabetics, they eventually die of a cardiovascular disease. No? Cardiovascular disease encompasses all those diseases of the heart, like chronic heart disease, cerebrovascular disease or stroke, and peripheral vascular disease, or they're all blood vessel diseases that supply your heart, your brain, and your upper and lower extremities. So with that in mind, that means that if you're a poorly controlled diabetic, you have a great risk to develop a heart attack, a stroke, or a lower extremity amputation. No? So that means yung mga non-traumatic amputations or pagkaputol po ng mga paa or daliri sa paa, sometimes majority of them, like 60 to 80% of them, are secondary to diabetes. So that's one. The second complication that we're really scared of is the renal failure. No? So diabetes accounts for a little about half of all new cases of patients who have to have renal replacement treatment. That means either hemodialysis or peritoneal dialysis. And diabetes is the number one cause of end-stage renal disease or renal failure in the Philippines and worldwide. And if you combine diabetes with hypertension, they account for 80% of all patients on dialysis. So it's really a very bad thing to be diabetic and have another comorbidity like hypertension.
Yeah.
Now, not only that, diabetes also accounts for the blindness. No? So these are other complications that we're really scared of. Aside from the neuropathy. Neuropathy is when your nerves or your ugat pandamdam, they're all going crazy. No? So when you touch something and it's supposed to be hot, the patient with diabetes will feel it to be just warm, so they keep their hand on it, and then before they know it, they're already having burns. So I have a lot of patients like that. So neuropathy is also one of those complications of diabetes that decreases the quality of life of a diabetic. So that's the reason why we always tell the patient, please help us help you in preventing these complications of diabetes from setting in by having better sugar control.
Right. And we've been talking to the patient so far, Doctora, but I think we also need to address the carer or the other members of the family. No? Would you, kasi minsan it's that support eh. So the patient doesn't feel, I guess, alone or singled out, diba?
Yes.
So what is your advice to the carers or family members of a diabetic patient?
Usually, when a patient with diabetes would seek consult in the clinic, I always tell them, bring a family member along. So these family members are now aware of the condition of their relative, so they would be more supportive. And sometimes I really talk to the relatives because sometimes they get to be too strict and the patient now doesn't get to eat anything and they get to be sad, and then yan, pangit na. No, so I just tell them, so they just encourage mommy or daddy to be eating the better foods, and then encourage them to be working, like walking around, moving. So I tell the relatives, you should be a part of the treatment regimen of your relative. And I also tell them, since you are relatives, you also may develop this later on. So it's good for you to be learning about this now. No? So that's the role of the family. They should be part of the support group for the patient.
Okay. Wow. We've covered everything, Doctora, from the kinds of diabetes to the causes, exercises, diet, okay, even the family, no, or carer support. Okay.
Yes.
So, and complications, most importantly. Oh my gosh. Parang, una muna po, tayong mga, wala po sa atin can afford to be sick. Hindi po ba? Lagi nating sinasabi. Especially now. No? So, part of avoiding that, pati yung gastos, kung ganun tayo mag-isip, is to really stay healthy and to follow our doctor's advice. And ako, para sa akin, hindi ko na po hintayin ang diagnosis na diabetic ako bago ko pa i-adopt yung mga tips na shinare ni Doc Ai just now. So we're going into the last stretch of our interview, Doc Ai. Let's just talk about 2 myths, no? Let's debunk 2 myths na may kinalaman sa diabetes. Una muna, ang mga payat, hindi nagkaka-diabetes. Diba? Pag sinabing diabetes and yung mga morbidly obese, is that a myth? This is true or false, and why? What is the fact?
Well, it is a myth, no? So even the thin people get to have diabetes. And actually, nowadays, they say na you're diabetic but you're fat. No? So that's one. Actually, obesity really leads to a lot of metabolic abnormalities, including sugar, increase in blood pressure, increase in cholesterol levels. So it's accepted. It's really a proven fact that overweight and obesity will lead to diabetes. But what about the thin people? No? So sometimes they are thin because they are already diabetic and they are poorly controlled. So that's why they are thin. No? And if it runs in the family, then even having a thin body frame, but you're having a very bad lifestyle, then you can still be diabetic. No? So regardless of what your body frame is, if you're small, medium, large, extra large, triple large, it doesn't matter. No, we all have to live healthily. So we will not be diabetics. No, so even if it runs in your genes, as I've said earlier, you can put a stop to it. No? So just keep a healthy lifestyle.
Okay, Doctora, loud and clear. Okay, hindi lang po ang overweight or obese ang pwedeng maging diabetic. Pwedeng yung mga skinny din. Kasi nga, baka may diabetes na. Ito kayo importante yung annual exam. Na, Doktora,
yes, correct. That's very important. Because sometimes, we actually find a lot of newly diagnosed diabetics just on the annual exam.
Yeah. Oh my gosh. That reminds me I have to have mine soon. Okay.
Yeah.
Okay. Second myth, Doktora. I know a lot of mga 20-somethings, no? Parang mabilis pa naman yung metabolism ko eh. So, okay lang, tsaka na ako mag-exercise pag when I'm in my mid-30s to my 40s, di ba? Yung parang, nandun na sa age na may onset na. Is that fact? Is that a myth? Or is that ano? It's wrong? And what are the facts?
That's a very, very bad myth. It's very, very wrong, no? So it's quite saddening that the youth nowadays or the young adults, no, they just want to work and not take care of their health, because primarily just what you're saying, because they think they're still very young and they can eventually catch up later on with exercise and sleep and no stress and all of that. But actually, the fact is nowadays we see a lot of very young adults who have diabetes. And sometimes sometimes it's so scary because a 28-year-old diabetic will have a stroke or will have a heart attack. And it's so sad because they're not even 30s yet, they're not even at the height of their careers or chosen paths in life, and yet they already have these complications, primarily because they're really very big, they have this pangit na lifestyle, just eating anything in sight, not exercising, drinking a lot of the sugar beverages and all of that, no? So it's really sad that we have a lot of young adults who are already diabetics. And a lot of them aside from having all of these cardiovascular diseases, they have renal failure. So we also have a lot of young diabetics who are on dialysis. No? So it's very sad. It's really very sad. So please don't do that. When you're diagnosed to be diabetic, then you really have to do the good lifestyle, take your medication, see your doctor. And if you're not yet diabetic, then don't wait. Just like what Kai had said, don't wait to be diabetic. Like practice a healthy lifestyle so you don't get to be diabetic later on.
Okay, yeah. And we are repeating this like a broken record because it is a very important message that we really want to parang may plant po sa inyo, no? And please spread the word. Share po ninyo itong interview natin with Doktora para mas marami pang makaintindi kung ano ba talaga yung causes, ano ang komplikasyon ng diabetes, and how will it affect talaga our life and our family, no? At the same time, even after getting diagnosed, it's not a life sentence. So kung mawalan ng pag-asa, makinig sa doktor at sundin ang doktor. Okay? So, Doc Ai, for my last question, pwede rin siyang repeat pero ulitin natin. No? Para sa mga nanonood na, kasi ang viewers namin dito sa Hello Doctor, madami ang meron ng suspecha. No? They're looking up symptoms. Or either that or na-diagnose na sila or they're caring for a patient. So, ano ang iyong mensahe sa kanila? What is your message to them as far as diabetes is concerned?
Okay. So, actually, for those people who already have diabetes, okay, you don't have to be leading a lonely life, no? So, you don't have to be sad. All you have to do is discipline yourselves. Accept that you are diabetic. You can live with it, be happy with it. You just have to make sure that you have a good diet and enough exercise. Basically, a good lifestyle. No smoking, moderate intake of alcohol, less stress. No? So all of these can make you have a good quality of life even if you are diabetic. Of course, you have to know what your other risk factors are because diabetes, they have a gang of friends. May barkada yan eh. Hypertension, hypercholesterolemia, meaning increased cholesterol levels, increased blood pressure. So you also have to look into this because if you are not able to control the blood pressure or the cholesterol and you're just controlling the blood sugar, then you can still get the other complications like cardiovascular disease, renal failure, and all of that. So it would be best for you to know what your risk factors are, go visit your doctor, and there are a lot of websites also that can help you with this one. There's like the For Your Sweetheart website, and in this you will be taught all about diabetes and its complications, and also there's also the Framingham risk assessment test there, so you would know if you have the risk to develop all of the cardiovascular diseases also that may be present in diabetes. So again, it's easy to live with diabetes. You just have to live healthy and be disciplined. Visit your doctor regularly.
Okay, thank you for that, Doc Ai. So, yung website po is foryoursweetheart.ph. Okay? Bisitahin niyo po yun right after watching this interview. So, there you have it. Doc Ai Falier, President of the Alliance of Clinical Endocrinologists in the Philippines. I learned so much in this 1 hour. I mean, we publish a lot of stories on diabetes, but you know, it's always good to keep learning, to keep relearning. And I appreciate the message being repeated over and over again because like today, ang excuse ko, doktora, parang nagme-medicate pa ako hindi comfortable yung earbuds ko pero yung bike ko naghihintay dito sa tabi. Parang buong araw ka na naman nakaupo. Alam mo yun, doktora, parang I think we can never get enough reminders to take care of our health.
Yes, and especially Kai, I just want to say because a lot of our people are just working from home and majority are just sitting down and all of that. We have to remember that now sitting is the new smoking, no? So if smoking kills, sitting kills as well. So I always tell the patients who are working from home, every now and then you have to get up and walk around. Try to exercise while you're working from home, no? So take advantage of this COVID pandemic when we're just at home. I think it would be nice because now you get to really have some time for yourself, so you can exercise, look into the food that you're eating. Unlike before, then when we were still working outside, then you have to hurry because of the traffic and all of that, so you have to make more time for work, no? But now, since you're working from home, then I guess now we can take care more of our family and ourselves. So that's, I think, the plus point of having the quarantine.
Yeah, I agree, Tokay. Sometimes I used to work in a building that was 45 minutes away from my condo, and I really walked. I walked going home
Oh,
every day.
wow, really?
Yeah,
That's nice.
it was also kind of no, you decompress. So by the time you get home, you've let go of your work mode and you're ready to be in the home mode. And I miss
Yeah, that's
that.
true.
Yeah, I miss
Mm-hmm.
that. I had friends who were saying, wow, kawawa ka naman, mag-grab ka na lang. Parang, ba't ako naging kawawa? Naglalakad na ako eh.
Yeah, but
Sabi
you
nga,
know, the walking really relieves you of the stress. No, it clears your mind. That's what I tell the patients. Walking is really a very, very good exercise, not just for your body, but for your mind as well.
yeah, for the creative mind, people like us have to think of ideas, no? You look around randomly and just lightly looking at people, new ideas go into your head. So yeah,
Mm-hmm.
walking, brisk walking, right?
Mm-hmm.
So
Yes,
thank you, Doc Ai. Thank you for spending an hour with us talking about diabetes,
it's my
cardiovascular
pleasure.
health, and for your sweetheart.ph. So everyone, please visit that website right after watching this. So this has been Kai Magsanok of Hello Doctor Philippines for our very first Ask the Expert video interview. Please join us again for the next one as we talk to another medical expert about another pressing medical issue that whose conversation needs to happen now. Until then, stay well and be safe.